The message needs to be told to as many people as possible that getting the vaccine is safe, getting it is smart. It's a good idea for not only you personally, but for the entire community.
Community of the colors and our minority communities, we've had a significant amount of challenges. So this disease disproportionately has impacted these communities. You look at healthcare equity and access. Even before this COVID-19 pandemic, there's a lot that we need to do as a community. I definitely understand the hesitancy.
Some would call that lack of equity in terms of the ability to get the vaccine, while others refer to it as lack of information, false rumors, or lack of trust in the vaccine in communities of color.
There's a fear of that it happened too soon, that it happened too fast, that it got approved too quick. But we have to have trust in our doctors and those that are doing the research that it's going to be a safe outlet for us so that we can get back to some normalcy.
Some of it is because people don't know and don't read the facts.
And it's not only people of color who are reluctant to get the vaccine. New Britain's Polish community also has their reservations.
And not only reluctant, I'd say very reluctant. My message to them is, look at me. I've already gotten both of my shots, no after effects.
As an infectious diseases specialist and someone who's been seeing COVID patients throughout this pandemic, I want to assure you that this vaccine is safe based on the data that we have and the studies that we have.
But there's also a hesitancy. A recent study from the Center for Disease Control and Prevention shows that at a national level, as of March, of the 54% of people who had received at least one dose of the vaccine, 2/3 were white, 9% were Hispanic, and 7% were Black. Health professionals agree that those numbers have to change. It's a matter of life and death.
So life expectancy has gone down by a year because of COVID-19. In certain population, African American males, that's reduced by 3 years.
I encourage you, please go save your life, but most of all, save my life in the community.
Everyone agrees that counting on everyone to get the COVID-19 vaccine when it's their turn is our only hope of getting back to life as we once knew it.
I look at the street and I think about it a year ago, how vibrant, how people were out shopping, how people were out walking around. I don't see that right now. In order to get back to normal, we have to cooperate with the professionals who are telling us that vaccines work.
This can't be the new normal for us, just wearing a mask and keeping our distance from each other. It's not who we are. In the Spanish culture, we embrace people, we like to hug.
It's vital for us to know that I can look at you and you've done your duty as a community person, as a person that cares about our race, brown and Black people, and all people in general. Take the vaccine, please. I encourage you.
We've already had 500,000 deaths and probably more than that can be attributed to COVID-19 but have not been attributed to COVID-19. And again, everybody has to do their share.
The community is ready to get back to normal. We want to go back to having events and being at, Bees baseball games and being together. We're ready. People want to get back to some sense of normalcy, and the easiest way to get there is by getting vaccinated. So when it's your turn, get the vaccine. It's safe, it's smart, let's get back to normal.